Welcome to this short presentation. Yesterday afternoon we had an alert about Ebola outbreak in the Democratic Republic of Congo. And I know many of you will get scared or worried about what is this Ebola, how can I stay safe from conducting it, and what am I supposed to do when I have an information about somebody who has conducted it in my neighborhood. Now, Ebola outbreak happened recently, 3 to 4 years ago in West Africa. Over 10,000 people lost their lives. So we are dealing with a very serious disease here. The Democratic Republic of Congo is just neighboring to us. We have many staff who work in this location who travel frequently to Congo, and we can end up having a problem of conducting it through travelers going in and out of the country. Now have a look at the background of what this Ebola is. According to the World Health Organization, Ebola is one of the most virulent known diseases known to humankind. There are 5 distinct species of the genus Ebola, but we will focus on the Zaire virus because it is happening in the Congo, and this is the virus that is responsible for the outbreak at the moment. Ebola fatality rate is very high, from 25 to 90% of all clinically ill cases end up dying from the disease. And still, there is no known cure or vaccine for Ebola virus. The only possible treatment so far is when people use whole blood or plasma of Ebola survivors in treating other patients. This is according to the World Health Organization. But what is this Ebola? This is the photo of that virus. Very dangerous virus it is. Now we are going to look at how it is transmitted. Transmission occurs. I have put 2 photos there. We have somebody holding a bat. We also have the primates, the chimpanzees. Transmission occurs through contact with either infected human beings, people who have already conducted the Ebola. If you have contact with them through their body fluids, blood, or even sweat, such kind of things, you can end up conducting Ebola. Also through animals, wild animals like these primates and the bats, the fruit bats, they are responsible for transmitting, either be they dead or be they alive, they can transmit Ebola to humans. So any interaction you can have with such animals, you can end up having a problem of conducting Ebola. Also for the health workers working in the centers handling these Ebola cases, they can end up getting the disease transmitted to them from patients while they are handling them. Say they are taking blood lab test or such kind of stuff. After checking the transmissions, we need now to focus on the disease symptoms. Now you'll be surprised because from the first day to the 5th day, the symptoms of Ebola is just like the normal fever. High temperatures, somebody feeling cold or something like that, or shaking because of high fever and such kind of things. But when it comes to day 7, there is something significant happen. The patient will feel a lot of fatigue. Of course, fever will be there and muscle soreness. By the time you are day 10, there is sudden high fever, vomiting of blood, and very passive behavior in patients has been recorded. Back to day 4 to day 11, bruising, brain damage, bleeding from the mouth or from the ears or any other eye openings, or if a patient has injection, maybe to take a blood sample, they can end up bleeding in those points. And by day 12, there's loss of consciousness, seizure, massive internal bleeding that leads to death. So when a patient conducts Ebola by day 12, mostly they will be dead. Some of them will be lucky, they can get to the 21st day where the maximum incubation period of Ebola. I've put a photo showing how it looks like when somebody has reached the 21st day which is the incubation period that one has to really know that they already contracted Ebola. How do we prevent Ebola? Now we have already focused and said that there is no treatment for Ebola, so we better make ourselves safe from contracting it. That is our first line of defense. We have to avoid contact with blood, body fluids, or tissue of infected persons. Anybody you know that has contracted Ebola, stay away from them. Avoid contact with corpses who are victims of Ebola, so you don't have to attend funerals. Trained personnel will have to handle such cases of internment of Ebola victims. You have to avoid contact with infected primates and birds, whether they are dead or alive. Stay away from birds. I know we have a lot of birds in the eastern side of our camp. Stay away from contact with those birds. Avoid contact with people as much as possible. During this outbreak, no handshake, no hugging of anybody. Stay away. Try and make yourself a buffer zone whereby you are safe from conducting any transmission of this Ebola disease. And again, we have to wash hands regularly with soap and antiseptic liquids just to make sure you minimize contact with any virus. Now we have come to the end of this presentation. I am going to give you these references. You are going to have a look at them on your own. The European Center for Disease Prevention and Control. There's a document that was generated in 2015 which deals with the Ebola outbreak in West Africa. And then also I'm going to give you the UN master plan for dealing with Ebola situations. We have adopted the West African version because we are dealing with the same case in our mission here in Somalia. So we have to stay safe. If you know anybody whom you suspect to be an Ebola victim, we have the hotline for our level 2 medical clinic. Make a call to the medical doctor, inform them that you are suspecting someone is, because we are interacting with people coming from Congo and going back to Congo. We are never sure whether we are safe. And the best line of defense, as I have said, is that we have to stay safe from contacting this virus. Okay, that's come to the end of the presentation. Okay. Thank you.